This is Sarah. She's busy discovering life like any other healthy, happy little 3-year-old. But Sarah's future, like any child's, is not 100% certain. Sarah's parents explored a number of options available to them at Sarah's birth and were very happy that their gynecologist had made them aware of stem cell banking to help safeguard Sarah's future health. Stem cell banking is a form of medical insurance and gives parents the opportunity to bank their baby's umbilical cord blood and tissue stem cells at birth for potential future medical use. A baby's umbilical cord is normally discarded as medical waste. However, parents have the opportunity to collect this valuable source of stem cells at birth. These stem cells are biologically younger than cells collected later in life and have a better regenerative potential. Why should you bank your baby's cord blood? The hematopoietic blood-forming stem cells found in your baby's cord blood are currently being used to treat over 80 blood-related diseases. They are used in transplants to regenerate bone marrow, treating diseases such as leukemia, lymphoma, thalassemia, Fanconi's anemia, and sickle cell anemia. How does it work? Cord blood is collected in a blood bag immediately after the birth of your baby by your gynecologist or midwife. This is a safe, quick, and painless procedure. The cord blood is a 100% match for your baby, and there is a 25% chance of it being a match for a sibling. Why should you bank your baby's cord tissue? The mesenchymal stem cells found in your baby's cord tissue give rise to the connective tissues of the body, such as your skin, bone, nerves, cartilage, and fat. These stem cells are currently in the clinical trial phase, with research focused on treating a huge variety of conditions, such as muscle and bone injury, autoimmune disease, heart disease, diabetes, neurological disease, spinal cord injury, wound healing, and bone marrow transplant complications. How does it work? After the cord blood is collected and the placenta is delivered, a piece of cord tissue is collected and placed in the container provided. Sarah's gynecologist explained how easy it was to register for stem cell banking with Netcells, with an easy online registration on the Netcells website. They met with a Netcells consultant who personally handed over the Netcells collection kit. They explained everything to Sarah's mom and dad. When it was time for Sarah to be born, her father ensured he took the Netcells collection kit along to the hospital. When they arrived at the hospital, Sarah's parents reminded their gynecologist that they were going to collect Sarah's stem cells. Once Sarah was safely born, their gynecologist collected the stem cells from the umbilical cord. It only took a few minutes. A phlebotomist came to take Sarah's mom's blood when she was back in the maternity ward so that it could be tested for any transmissible diseases. Sarah's parents completed the documentation and ensured that everything had been packaged correctly by following the checklist in the kit. They called the Netcells consultant to arrange the courier of Sarah's stem cells to the Netcells laboratory for processing. Once processed, Sarah's stem cells were cryogenically frozen and stored in large specialized tanks. They remain in these tanks until they are needed. Sarah's mom and dad were issued with the results and storage certificate. Today, Netcells stem cell banking continues to help ensure my future. My future has a chance at a happy ending. Make sure your child's does too. If you are expecting a baby or planning to have a family, please speak to your gynecologist or midwife about banking your baby's stem cells with Netcells. Netcells is internationally accredited by the AABB and also has ISO accreditation for your peace of mind. Make them your choice. Invest in your family's future health with Netcells.